I will talk about alcohol de-addiction, the most commonest addiction in the world, alcohol. Before starting about the treatment of de-addiction, I want to make it clear that all who take alcohol does not require treatment. Some people take alcohol in low amount and some people take in large amount. So those who are addicted means those who take alcohol daily in high volume require de-addiction treatment. The main cause of alcohol addiction is depression disease. So we have to understand that if somebody is having depression will fall in the trap of alcohol addiction or any other addiction very easily. Many people, many family try to take out for the patient from the addiction, but most of the time they failed. I will tell about some 10 to 12 important facts about the alcohol addiction treatment. First of all, how to start talking to an addicted person. The family member should understand, should learn the way of communication with alcohol addicted family member. Then and then only you can take him out from alcohol addiction. If anybody give any advice of alcohol about to leave the alcohol patient takes advice like enemy of the person. If you give alcohol the addiction advice, don't start from this point. Don't enumerate the side effect of alcohol. Don't blame for anything. Start good communication. That is important. Your any treatment, any type of treatment will start from this point. If you are able to communicate with alcohol addicted patient very easily, this should be in the mind that those who are taking alcohol in the large amount too can communicate the way we should learn. I worked with brown sugar addicted patient, cocaine patient, and many other smell aging agent. What I find that there is a place, there is a there is a place, there is a possibility that we can communicate with them, and the communication is the most important and the initial step if we want to get rid of alcohol. Communication is most important. So if you are talking to the alcoholic patient, don't raise the topic of alcohol harmfulness. Don't give advice to leave alcohol. Just start with simple conversion, communication, and the topic should be initiated by alcoholic patient. Listen them. Listening is the most important skill, and in the alcoholic patient, you have to listen more than from any other else. They talk very much, but you have to listen. When you listen, then they consider alcoholic patient consider you as a friend. If you don't listen and you will speak, they will think that you are enemy. So try to communicate with alcoholic patient in the practical manner, not in the old manner, which is most of the time 100% time unsuccessful. If you enumerate the cause of side effect of alcohol addiction, just communicate first. That is the most important and initial part of alcohol. And we will talk about the second most important point. As we give time to the patient to recover, and we should give time to alcoholic patient time to recover. Many families in which alcoholic patient there, they don't consider alcohol as a patient as a patient. Person who take alcohol in high amount addicted is a patient, and we should consider them as a patient. If we don't consider them as a patient, it will not work. We should have sympathy to them, and as in, if anybody has a fracture, can't walk in 1 or 2 days or 1 to 2 weeks, an alcoholic patient can't escape from the alcohol from 2 to 3 days. It requires time. So main point is that family member should consider alcoholic as a patient. When you consider alcoholic as a patient, then and then only you can take him out from alcohol. The first point was that you have to communicate with alcoholic patient in a very practical manner. Don't give the advice to leave alcohol, and don't enumerate the side effect of alcohol. Just communicate, and communicate, you have to listen first. Then consider alcoholic as a patient. This is the second most important point. The third fact we should know about the alcoholic addiction is that alcohol if somebody fall in alcohol addiction, there are many diseases, 6 to 7 type of diseases the person is suffering from, those who have alcohol addiction. So we have to evaluate the diseases, and we have to make a plan according to it. Then after evaluation, the fourth point comes. What is our target of alcohol addiction or a complete alcohol addiction? Never keep the target complete alcohol addiction, because it is not practical and it is not possible to. Person will take alcohol after most of the treatment. Our target should be that he should reduce alcohol. If he is taking 30 times in a month, and he succeeded to take to reduce it to 2 or 3 times in a month, it is a good progress. Don't consider as a bad progress. If we are successful in reducing 10 to 20 times, that is also good. Complete uh, leaving of alcohol is not possible and not required to. What happens when somebody leave alcohol? Sometime in a month or in a 3 month, he take alcohol, and family member become anger about this behavior. So try to understand that alcohol addicted patient will take some bites of alcohol in a month or in a week. Our plan should be reduction, not okay. So now comes our fourth point. This is also important. We should not be any hurry for de-addiction treatment. What the family does for alcohol de-addiction, they lock the alcoholic patient in a room. That is very, very dangerous. It can cause suicidal tendency. It can cause rise in high blood pressure. It can cause heart attack. So and withdrawal of alcohol withdrawal is dangerous. It can lead to seizure too, epileptic fits. These are the possibilities. So never, never, and never show any hurry in alcohol de-addiction. Keep it gradual. Don't go for sudden change. Sudden change is dangerous. Keep it in the mind. Sudden change in alcoholic consumption is dangerous. So we have covered 4 points. Now we'll go for the next important point, and it's called understanding the depression disease. Just family member of alcoholic patient must learn about depression disease. This is the most important step in the alcohol de-addiction. When we learn and read about depression disease, and we will talk about depression disease to alcoholic patient, changes will come gradually. The most important cause of alcohol addiction or any other addiction is depression disease. So it is very much required. Family member should should learn depression, and it is not difficult. It takes times, but it is not impossible. Give the time to learn depression disease. Depression disease is the way through by which you can take alcoholic patient to the newer world. Hard work in understanding depression disease, because psychiatrists and clinical psychologists will not be available every time. There are many videos about the depression disease by many psychiatrists and many psychologists. It's freely available. If you love them, you have to understand depression disease. Most and most important, step that we should take. Depression is an also genetical disease, and it will also come in their children. So it will be profited to your children too, and many more. There are many things about the depression disease, and by learning depression disease, you can teach many people about the treatment of alcohol de-addiction. So, learning depression disease is very much required for alcoholic addiction treatment. So, now we covered 5 to 6 points. I don't remember the number, but if anything is left, I will make it clear in the next video. The important point is now is the balanced diet. The main cause of alcohol addiction, main cause of depression disease is not taking the balanced diet. So balanced diet is also required for the de-addiction treatment. And I have posted many videos about balanced diet, and I will make a separate video for alcohol addiction treatment for the balanced diet, and you can ask a question about it. Most of the videos are available in Hindi, and now I am making videos on in English too. So balanced diet is also an important part in the treatment of alcohol addiction, because before alcohol addiction and during alcohol addiction and after alcohol addiction, vitamins and calcium and many nutrients are required in the large amount and balanced amount for healing. Now, after balanced diet, we come to the next point, and this is the tablet disulfiram. This tablet should be used only and only after doctor prescription. This is advice to everyone in India or anywhere place in the world. Disulfiram tablet should be prescribed before its consumption, because many alcoholic patients have many serious disease like liver failure disease or kidney failure disease, in which disulfiram cannot be taken. So this is the this tablet should be given after doctor prescription, and we should learn about the way. If doctor has prescribed the tablet, then you should learn the proper way of giving this tablet. Disulfiram tablet comes in 250 milligram, and it should not be given at the dose of 250 milligram. It should be reduced to 30 milligram or 40 milligram, means 1/8 of that tablet. When we give 1/8 of this tablet, it does not give sudden effect. But when we give it for 1 or 2 months, with already become 5 to 6 tablet 1 or 2 months, it shows little effect, and this little effect is a turning point in our de-addiction treatment. Then then patient will reduce the alcohol consumption by 5%, 10%, then 20%, 30%, and 50%. So they will reduce up to 30 to 40% by this tablet. Keep it in mind. Every point in alcohol addiction treatment is important. whether it is a communication, whether it is depression disease treatment, whether it is we are considering alcoholic as a patient, or every point is important. We can win the game only when we have all the players. Keep in the mind, all players are required for the addiction treatment. So now, when somebody tries to leave alcohol, come out from the alcohol, most important problem is insomnia. Insomnia treatment is given by the doctor. Some tablets uh, prescribed by the doctor for insomnia, but you should keep in the mind, never give them full pack of tablet, otherwise they will start sleeping pills addiction. It should be managed and it should be prescribed by only doctor. So insomnia treatment is also required for alcoholic addiction. Key patients if we are treating alcoholic, because it takes times, every point is important. Now I will tell some important food main, and that is a boiled potato. Boiled potato is most important food for alcoholic addiction treatment, more valuable than the multivitamin tablets or any other food supplement. And this is one is that boiled potato. Use boiled potato. Boiled potato contain vitamin B3 in large amount. The amount of vitamin B3 in potato is about 10 to 15 times more than any other vegetable or any other fruits. And there is a wide deficiency of vitamin B3 in alcoholic patient, and something related with antidepressant, depression. So we have to give boiled potato daily to the alcoholic patient, and it is possible only when we have started communicating with alcoholic patient. So as I have told in the initial part, that communication is most important part in alcoholic addiction treatment. You can ask any question about alcoholic treatment. From my side, my advice is totally free, and in many countries like our country too, antidepressant tablet is free, psychiatric treatment is free in district places, not in tehsil places. There are many ways in India through which we can alcoholic addiction treatment free. There is no need to spend much of money in alcoholic treatment, and you can see the porting. So this is our Jamunia Lake in our district, Sihor. So we have to consider those diseases too, which arise due to the side effect of alcohol, like vitamin B deficiencies, liver cirrhosis, and most many other diseases. But this is possible only when we start communication with alcoholic patient. So this is for today, and we will start like that tomorrow too. So keep in the mind the most important point that I have started, and I will go repeat also once again. If you give advice to an alcoholic patient that alcohol is harmful, you should leave alcohol, you should not take alcohol, then alcoholic patient will take consider as you are enemy. So communicate practically. Thank you very much.